look at treatment options for adolescent scoliosis, is that it's normally divided into severities. And traditional treatment options have very limited approaches to try to reduce the scoliosis. And normally they're reacting to curves as they worsen. And as they worsen, the treatments get more and more invasive. So curves that are diagnosed less than 25 degrees, this is considered a mild scoliosis, meaning it's too small to consider surgery. So they do nothing and they just watch and see what happens. It's like there's no treatment actually recommended. Once you break 25 degrees and less than 40, and the adolescent is going through rapid puberty, they may recommend a Boston brace, and the very best thing is to try to slow down the progression of the scoliosis while they're growing. They're not really trying to reduce the curve and make it better, they're just trying to slow it down. And of course, once the scoliosis breaks this 40-degree range, this is when they start considering surgery, and this is where they do spinal fusion and they limit movement and motion of the spine to help improve alignment. And that's really it. Those are the traditional approaches. Modern conservative approaches, the goal is very different. It's to reduce the curve and reduce it as much as we can possibly reduce it, to make the curve as small as possible during growth, because the more you reduce the curve during the growth phase, the less likely it is to progress and the better adult life the person has in front of them. So our options are to try to reduce the curves as aggressively as possible using a combination of treatments: therapy, rehabilitation, exercise, home therapy, home rehabilitation, and home exercises. And of course, something called corrective bracing that's going to try to reduce the size of the curve with the brace that actually corrects the spine and corrects the body, and that just tries to slow it down.